Okay, we're live. Tell us your name, please.
Dr. Paul Finucan.
And what kind of a doctor are you?
Alternative medicine, natural medicine, chiropractor, naturopath,
Nice.
acupuncturist, nutrition.
Nice. And you are?
Mark McCollaum, physician assistant, primary care for 30 years.
Okay, so why are you both here? Are you both here to warn us, to tell us about treatment, how you got, where would you like to go? What would you like to tell the world?
Definitely about wellness.
Okay, please, yeah.
Yeah, as far as, we treat any and all conditions with wellness as the first line of help in nutrition and wellness treatments, but all kinds of modalities. But we've worked a lot, we understand, with the COVID patients. I didn't lose a single person that we know of to COVID, but we've had people have complications with the vaccines, and we're trying to help them recover and not have injury, not have damage, and hopefully not take any more that's caused problems for them.
So on the bus we're saying COVID, shot, injury and death, and unbelievable, more than the COVID shot, injury and death, hospital protocol death of the unvaccinated.
Right. Yeah, we've had patients that were doing great, and then they had a shot or a booster. Now they're having strokes, blood clots, and some have passed away from medical care or from the vaccines.
Now, what about shedding? Because we're hearing from the people who did not take the shot that are showing now symptoms of the injured from the shot.
Well, none of my staff had been sick or ill, but we treated people the whole time. We did have some of our staff out, but we recovered quickly because of our protocols and treatments. But we had doctors who had never been out sick that were probably because of shedding, or so many sick people that we were around. But we've all recovered and done well because of our natural treatments and great staff and great doctors.
Yeah, the key to getting over this, whether it goes into pandemic state again or not, is going to be starting off with a good, healthy immune system. And something as simple as getting a vitamin D level that's up over 50 or 60 versus the usual somewhere between 15 and 30 that even most people in Florida have, that when we test, can mean the difference between, is this going to be a cold, maybe a bad flu, or something that's going to land you in the hospital and then at the hands of the drug companies and the what I call the death protocols.
Why do you think the vitamin D level is so low in people at the moment?
We've been told for the last 30 years, protect your skin, wear sunscreen, stay out of the sun, you're going to get skin cancer, and all it's really done is it's just caused everybody to have low vitamin D levels. They put vitamin D in milk. Okay, it's enough to kind of keep your bones going, but it's not really enough to keep your immune system strong. So it starts off with having adequate amounts of proper nutrition, including zinc, vitamin C, and also vitamin D. That's the foundation of the pyramid to whether this turns into, again, a cold, or if it's going to be potentially life-threatening or the cause of death.
What do you think is happening with this whole white lung pneumonia in children? We think from experience that they are now targeting the unvaccinated child. So we have this situation where all the scaremongering news, pneumonia, all around the world, coincidentally, every child, and it's all about get vaccinated with RSV, COVID, and flu. Pretty sure within a month or two, the hospitals will be full of unvaccinated children.
Myself and my children, 5 children, we've never had vaccines. I'm 66, never had a shot or vaccine, and they're exceptionally well and healthy. And we try to help patients learn and live that way. So what I'm saying is, we haven't been vaccinated. I've never had a vaccine, never will, and we've been very healthy. And we see every teacher that my children had, they said how exceptional they were. They're just healthy kids.
So we know the health of the unvaccinated. So what I'm trying to help here are the people that are still brainwashed, like the military groups and all those other mummy groups. They're all freaking out right now about the white lung COVID pneumonia in the children. And so how do we break through to these people to not rush their children into hospital? So the ones that are partially vaccinated and they want to stop, but they're so scared, they can see the health of your children.
It's fear tactics.
Yeah.
It's all misinformation and fear. They'll tell you, if you don't get these vaccines, you're a bad mom, or you're a bad parent, or you don't love your children. You would rather have a dead child than a vaccinated child. And they use fear and misinformation because they're told to. They're mandated. If they work for a hospital system, that's who pays their paycheck. If they go against the grain, even if they feel otherwise, they know that they cannot speak out against the vaccination program, because to do so would be cause for termination,
Now,
whether
if
they believe it or not.
if a child in today's age dies in hospital and is not totally up to date on vaccinated, that child is classed as unvaxxed. So this is how they're going to be reporting on it.
Right. So they've had vaccines, but they haven't had.
They just haven't had the recent RSV,
Right.
COVID.
Right. So they're saying they're unvaxxed.
So I'm sorry, you're unvaxxed. You're not to that. So that's how they class it, unvaxxed. According to the nurses, pediatric nurses and doctors that we speak to, that is the protocol
and the
now.
Injuries aren't being reported. We have patients come in on a regular basis that they've told their medical doctor that I've been sick ever since I had the vaccine, and it's not being put in their chart, and the doctors aren't acknowledging it. And we see that continuously.
And still pushing the COVID
And
shot.
Still pushing
Yes.
the vaccines.
Yes.
And take a shingles and a pneumococcal, whatever it is, while we're here.
Right.
And a
Absolutely.
flu shot.
Yeah.
How are we going to break the cycle of this?
Education.
It's
People
exhausting though, isn't it?
People
Yeah.
have to know that they have
Well-
options and that they do not have to be forced into taking these vaccines. You can go to school without having all of these vaccines.
Yeah, like I said, all my kids and grandkids have been in public school, private school, and they weren't vaccinated.
Do you have any
They're-
autism in them?
As far as no, my kids are healthy. There's not.
Do you have
a
any
problem.
paralysis?
No, none of my kids have had any serious illnesses. So, yeah.
I mean,
there's-
it's just undeniable, isn't it?
Well, and when you see areas where there weren't vaccines, and also vaccines are brought there, more and more problems are occurring.
Have you guys read the Vax Unvax book by Dr. Brian Hooker? Okay, I'm giving you both a copy of that.
Yeah,
You're
I
going to
haven't- I
love
haven't
it.
Like that.
Yeah, sure.
Yeah, you're going to love it. Right, what else do you want to tell the people?
Well, we have a very wellness-orientated practice for family healthcare and all healthcare. We do a lot with clinical nutrition, IV nutrition, regenerative medicine. We work a lot with athletes. So we want to keep people healthy, and we have what we feel are the best natural protocols and other treatments to help people stay healthy or regain their health when they're sick or injured.
And when they do get sick, if they need it, we also use the FLCCC protocol, and we do treat with ivermectin. It works. I've treated over 750 cases with COVID, and I beat the national average. I've had 0 deaths.
Nice.
So it is treatable. It does not mean a death sentence if you get it. And people typically will get it one time, and if they keep their immune system strong. I've had COVID one time myself. That was 2.5 years ago. I had Delta strain. I still treat COVID patients. I treated 2 today. I don't get sick. My immune system stays strong, and I'm not really fearful of getting COVID again. If I get it, it's going to be a cold.
We'll
Do you
get well.
think?
We'll get over it.
I'll ask a question. Do you think COVID's real? Here's what I think it is. I think it's another. Every year we have different strains of flu. It mutates, and it's always a bit
Absolutely.
different. And but yet we had no flu, and we had this so-called COVID. I do not buy it.
They said COVID was the cure for the flu.
Yeah, we had no cases of flu that year because the hospitals were getting paid if they reported COVID.
Well, the whole thing is just so dark and twisted, and we've got there's just death. Everybody you see in here now is dead because of a vaccine or because of hospital protocol. We have more pictures we haven't even printed off and put on here. I mean, what's it going to take? What's enough?
Like I said, we constantly.
People are going to have to say enough is enough. And they're going to have to say, no, I'm not going to roll up my sleeve. I'm not going to be a lemming that's going to be led over to the edge of the cliff and jump because I'm afraid you're going to push me off.
Yeah.
It's fear.
Now, do you guys work in Naples here?
We work
Yes.
together. Yeah.
So this, I have to say, Claire here, and I are compiling a list of our favourite places in America, and you guys are right up here. We like it here. It helps. There's this place right here.
Oh, yeah. Yes.
But you've had some of the worst injuries we've seen, by the way. But it's the really, really strong people.
There's
This is
a lot
really
of
good.
There's a lot of good caring people
Viewers,
here.
Naples going up to the top of the list of places to move. They don't want us all moving here. There's that.
Right.
But I have to say, what an amazing place it is here.
Yeah, it's a great place for a family, and but we have a wonderful idea about health and wellness.
So one quick question that the Children's Health Defence bus team has, nothing to do with doctors, but because you live here, why are people putting nets over their swimming pools? Please tell me that's not for crocodiles and alligators and whatever Florida has.
Well, we have a pool cage because to keep out
Mosquitoes.
bugs and debris and dirt and leaves in the pool.
So it's just a
and so
thing
forth.
Florida does.
I mean,
I never seen it
if
anywhere
I-
else.
If I didn't
You
have
keep
a
the
pool,
mosquitoes out, otherwise at dusk the mosquitoes will carry you off.
Yeah.
So while we're in our Airbnb, we shouldn't freak out that alligators and crocodiles are going to come eat us in the night. Okay, thank you.
But if someone has a netting or something over their or a screen around, it's to make sure that you are compliant to
well,
keep
kids
children
are safe, so they're not
to
gonna
keep
wander
children
outside
from
somebody's
wandering
pool.
in and then falling into your pool and drowning.
It's like the whole of the gardens are netted, is what
Yes,
we're saying.
we call it a pool cage.
Yeah.
Okay. Very interesting facts as we go around America. We are learning. Anything else you want to tell the people?
If they
But
can
where can they follow you?
Well, as far as we're alternative health and healing center and integrative medicine, we work together. And if they want to know anything about health or wellness, we're a very good group of practitioners and have health and wellness as our first concern for each person.
First line is health and wellness, and then when you are sick, we'll get you through it. And if you've been injured either with the vaccines or long COVID, we have treatments that are very effective as well for that.
Yes. So Alternative Health and Healing Center, Naples, Florida, and Integrative Medicine, Naples, Florida, we work together.
Thank you both for everything you do for the children, for the future, for the people. We wish there were more doctors like you both. So thank you,
Well,
thank
thanks
you.
for having us.
And
Thank you for the
yes,
invitation.
and I think everyone's going to put you on speed dial as we go through.